Going to go ahead and get started. So thank you everybody for joining us today for our first official lecture for our geriatric resource course. So just as a summary again of what we're trying to do here with our courses, basically increase awareness about geriatric issues. And we like to start from healthy aging because too often you talk about the older population and your mind goes to bad places and awful things. So we definitely want to start off on a more positive foot of all of the opportunities available in the healthy aging realm. And keep in mind also that, your background may be such that some of this information is just old hat to you, and that's fine. We'll be having discussion at the end, and whatever you can add to that discussion will be great. You'll be teaching us. And some of this will be new to some people too. So we're not trying to create geriatric experts. We're just trying to really increase awareness about issues and resources. So our main person today is Lisa Mansfield, and she is going to go ahead and introduce herself. We will have some Q&A if you're worried about some issues about the actual processes and stuff about the GRC. We're going to save some time at the end for that, just so you know you can hang on to those questions for later. All right, Lisa.
Hi, everybody. So my name is Lisa Mansfield. I don't know if I'm the main anything here, but I'm going to kick us off. I have been with the agency for about 10 months now. So I brought out the big guns today, so to speak. I have brought all of my content experts some of my content experts for Summit County into the call with us today so that they can be the experts and tell us all about what they do. I see a lot of folks on here whose names I recognize, and that's really exciting. My title at Vantage is Director of Development and Community Partnerships, and I think that's why I recognize a lot of your names, because a lot of you we've already partnered with, or I partnered with you in my previous position at the probate court. So it's great to see so many of you on the call. Those of you who I don't know, I look forward to getting to know today and going forward. So we're going to talk a little bit about what Vantage is overall. And then, like I said, we're going to break it down into each of the 4 programs so that you get an understanding of who you need to reach out to, what those programs cover, and how we can best help you in what you do. And now I'm looking for the share screen button. Okay, that big green one right in the middle, Lise. So I'm going to share my screen. I love it on Zoom. It's so much easier. Don't understand why Teams makes it so hard for me. I'll play from the beginning. All right. Okay. So we are Vantage Aging. A lot of times when we say it, a lot of people mistake it for Advantage. No, it's Vantage Aging. And we, right in the logo there, it says who we are. And that's, I think, why Sue and Suma thought about starting off with us today, because we are promoting a positive perspective on aging. We all talk about, the goal is to live a long and healthy life. But as we're doing that, lots of questions come up and lots of things that we hadn't thought of. So that's why places like Vantage Aging, Direction Home, and the other places in our area are around to help us to navigate that. And for those of us who work with an aging population, we're incredibly rich in resources in Summit County, and we are incredibly dense sometimes as far as how do you dig through and figure out who are you supposed to call. So that's one of the reasons I'm glad that we're here today. So I'm not going to read this all to you. If you guys, it'll be on the recording, but also if you want to go to our website, you can read a lot about who we are. But our biggest thing is to give adults the opportunity to live a healthy life as they age, with as much independence, purpose, and dignity as possible. That's going to mean something different to just about everybody. So depending on their circumstance, depending on their choices. So we want to make sure that we can do that in whatever situation older adults find themselves, or with the choices they've made, or sometimes things that are beyond their choices are going to happen. So we have four main programs. They're listed there. I like to look at them in kind of two big chunks. They're the two, it makes it easier for me to talk about them. The first two, the Meals on Wheels and our home wellness solutions, we're going to cover those first. And those are to take care of needs mostly in the home. A lot of the folks that take advantage of these are homebound, but not all of them. They might just need a little bit of extra help. But with our help, they are able to be independent and live at home in a place that they choose, or the place that they choose, as long as possible. The other two are kind of outward facing. These are folks who can make big choices outside their home. So CSEP is going to be for adults that are 55 and older who are unemployed and are seeking employment. Sometimes that's because they thought they could live off Social Security and they found that they can't. Maybe they're now taking care of grandchildren they never thought they'd take care of. We have a lot of that, especially in Akron and Summit County. Or maybe they have had a career and now they want to have a second career. And these two, the CSEP and the RSVP program, I like to remind us that older adults have hopes and dreams. And we want to make sure that if you've not been able to fulfill all those, or if you have a new one, that you can do that. So that brings us to our fourth program, and that's our AmeriCorps Senior RSVP program. And that one is to connect older adults in our community to nonprofits in our community for volunteer opportunities. And Tess is going to talk about that more in depth, but that can be a long-term commitment where you're there once a week, or it can be a commitment where you volunteer once a year for just a couple of hours. And instead of having you have to go out and find those, we help find them for you. So we've been around for almost 50 years. We've got a big anniversary coming up in not too long a time. That puts a lot of pressure on me to plan something for that. But we did just celebrate our 50th anniversary for Meals on Wheels. So we're super excited to have had such a long history in our area. You can see the highlights that are listed there. There's lots of other things that have happened throughout the life of this agency, but these are the basics. We did do a rebrand in 2017, changing to Vantage Aging from Mature Services. That had been the name for a really long time. I jokingly say that, and I'm not sure this is the reason, so don't hold me to this, but I jokingly say that with the advance of the internet, if you search mature services, you may not get to what you're looking for in older adults. So Vantage helps clear that up just a little bit on that aspect. I'll leave that to your imagination. And in 2019, one of the biggest things that happened was we merged with Meals on Wheels of Stark and Wayne. Then that pesky COVID happened. So it's been quite a journey from 19 to the present. Big expansion in 23 when we went into a second state with the addition of Indiana to our CSEP program. So now, in addition to the counties that we were in Ohio, we're in some in Indiana. So a total of 75 counties across 2 states right now. So now it is my great pleasure to hand over to our Director of Home and Community-Based Services, Jennifer, and she's going to talk both about our Meals on Wheels program and our Home Wellness Solutions program. We're going to pause at the end of the Meals on Wheels program and see if you have any specific questions about that. Don't think you have to wait till the end. You can put those in the chat as we go, and we'll monitor that as well. But also, we'll take questions at the end. So if you want to wait till the end for all your questions, you can also, but we're going to pause at the end of each program before we move on to the next one, just so you don't forget what you were going to ask. And with that, I'm going to have Jennifer introduce herself.
Good afternoon, everybody. Thank you so much for letting us come out and share things that we're very passionate about how we help seniors in the community. I think Lisa mentioned something really poignant when she talks about helping seniors live independently at home. And for the two programs and the teams that I work on, the Meals on Wheels and the Home Wellness team, that is a major focus. Oftentimes, when we have a family member or an individual calling on the phone, they feel like having a home delivered meal is giving up their independence, versus acknowledging that having very small supports in the home often helps them remain in their home longer and therefore remain independent longer. Sometimes it's really just how you think about those services, and what we're trying to accomplish with them is to provide a healthy, nutritious meal, a wellness check, and those are things that maintain an individual's independence and choice. So, Lisa, if you're going to advance the slides, that would be great. All right. So this is a picture of one of our volunteers. I would say probably 2/3 of our meals, we have about 45 routes every day, are delivered by volunteers. We have a very strong volunteer base in Stark and Wayne counties, and we are working diligently to build that volunteer base in Summit County. It's such a great model. The volunteers are wonderful. They let us know anytime they have any concerns about a client, if there have been any changes in condition. And so we really appreciate their commitment to our mission. They often will say that it is their mission to take care of individuals. We had a winter storm last week on Friday, and so we had some open routes, and our volunteer coordinator, she called some of the volunteers, and they actually really want to dig in and really help in those situations. We lost very few volunteers during the COVID epidemic, and so they're a very important component of how we serve our communities. So the slide does say that we are in 7 communities. Our main areas of service, though, are Stark, Wayne, and Summit counties. And as it says here, senior hunger, 1 in 4 are suffering from poor nutrition, and 1 in 6 also face the threat of hunger. It's really important. I don't know if any of you are familiar with this summer when the SNAP benefits changed for individuals. They had been getting max SNAP benefits all during COVID, and just like Medicaid began to change, those SNAP benefits changed. So sometimes they would go from a couple $100s a month to $16 a month. So we've really seen a surge in need for our services to help them supplement their food insecurity needs. I always think this is astounding. I worked in a hospital for 18 years as a social worker, and I get a year's worth of home delivered meals is equal to 1 typical day in the hospital, not even in a specialized unit. So it is so much bang for the buck, so to speak. You get so many wonderful benefits from having those meals delivered on a regular basis. Like it said, we have a kitchen right here in Mansfield where I am today. It's our commissary. It's a professional kitchen. They make around 600 to 700 hot meals every day that are served, all homemade. I was in there the other day and they were breading pork chops. So they are really making soups and roux and all of those kinds of things homemade. Quality and appearance are very important to our kitchen staff and our kitchen manager. So we have hot meals. We have cold sandwich meals, we have frozen meals, and we have frozen breakfast meals. So we try to give a lot of person-centered. We try to be mindful of what each individual may or may not think is best for them. Delivery days, if you're a dialysis patient and you get dialysis 3 days a week, a home delivered meal that day is not important to you because you're not, or it's not. It's important. You're not available possibly to get that. So we try to accommodate really anybody's needs that they might have so that we can get them a hot, nutritious meal. And then Wheels for Wags. I would say it's been probably 12 years now that Meals on Wheels of America did a study about those who are receiving our meals who have pets in the home. Typically cats and dogs was the focus. How many of them were sharing their Meals on Wheels meal with their pet? And it was a significant number. And so the Meals on Wheels, Wheels for WAGs program started. It's not funded by any one or any agency in particular. We get donations, we write grants. We work very hard to make sure that we can give free cat and dog food to our individuals who need it. Their pets are their lifeline, their family member, and very important to them. So this is another way that wouldn't seem obvious where we're trying to help with the healthy aging component in providing that free pet food. Different payment options. We have different funding sources. Certainly you can pay privately. We get some federal funding. We have Medicaid funding as our main sources. We also write, Lisa's team writes a lot of grants. And we have it's probably been about a little more than a year and a half, we started a mobile food outreach program. So to get a home delivered meal, you can certainly pay privately. We can deliver it to anybody. But if you are trying to get meals delivered under a program that helps supplement the cost of the meals, you have to have certain criteria. And not everybody has that criteria, but that doesn't mean that they're not food insecure or in need. And so we were able to use one of our delivery vehicles to go out into the community and do outreach to individuals who are able to get to us, but are still food insecure. And these two lovely ladies are often on the team, and there are other individuals where we provide frozen meals and half gallons of milk to those in the community. And so that's been a wonderful addition to help us reach people that we wouldn't have been able to reach in the past. Healthy nutrition is such an important part of healthy aging. It helps you with wounds healing. It helps you with disease management. If we can get to people within a few days of them being discharged from a hospital or a skilled nursing facility, there's great data to support that we can help them from bouncing back into the hospital, and making sure that if you have certain conditions like coronary artery disease, that you're not going home and because you're in a weakened state from having been in a bed for a few days, that you're opening up maybe a can of soup that has a lot of salt content and is not going to be best for your medical conditions, that we can provide meals with no salt added that can help you in your recovery. And then there's certainly a lot of data in here about the cost savings that is incurred by getting home delivered meals. So there was a recent study by Meals on Wheels that talks about, again, some of those healthcare components, that it can reduce costs, reduce nursing home stays. It's a well check also. So when we do even a weekly meal delivery or a daily meal delivery, we're doing a well check on that person. We may be the only person that they are seeing or that they are talking to. They look so forward to the volunteers. And you will find that if you are subbing and you are delivering and they're like, who are you? Where is my volunteer? I was looking forward to seeing that person today. Well, sometimes our volunteers maybe get a day off from their usual routines. So those visits are so important. Those touch points are so important. We have a social worker on our staff that will call family members, call individuals to check on them, offer them additional resources. So there are just a lot of great benefits to being able to get a nutritious meal. Sometimes the nutritious meal is seeing what a nutritious meal looks like, tastes like, portion size. So that's another component that is helpful. Yes, we talk about it being more than a meal. So one of the things that we do, if individuals don't answer their door for their meal delivery, we follow up on that immediately within the hour typically. Last year we had almost 2,800 times that individuals did not answer their door for their meal delivery. And so we're calling them to see, did you just, not hear us? Were you at a doctor's appointment? You forgot to call and cancel? Are you in need of some medical assistance? Do we need to do a well check with the police going out to check on somebody if the circumstances warrant it? Calling family members to say, hey, mom didn't answer the door today. Can you check on them? Oftentimes we'll have families that live out of town. And so honestly for them, if they haven't gotten a call from us by 1 o'clock, they're like, mom or dad have been checked on today. Everything is good. I will check in with them after work like I usually do, but I know someone has seen them this afternoon. One other thing that we do is we also, because we have a social worker here, we link individuals with other resources in the community. So there were 400 instances last year or more that we referred people to other services, whether they are our client or someone calling in wanting some information, and we hear something that they're telling us that we think we've got a resource for you. It might not be us, but let me share with you who you could contact to maybe get you some help with some of the things that you needed. So if anybody has any questions, feel free to ask, or certainly, like Lisa said, we can answer them at the end.
I don't see any in the chat yet, but Jen, can you talk about some of the extra special things people do too, that we do too, that might not be thought of, like meals that are specially cut up, or things that some of our volunteers do for, I know we had one person that was sight impaired, and some incredible things that happen with that.
Sure. You know, because we are a part of this community and we think of everything as our neighbor, our friend, our family member that we deliver to, we had a driver. She wasn't telling me this story to tell me how she was helpful. She was telling me the story for some other reason, because she didn't even see it as being something extraordinary. But she had an individual, like Lisa referred to, that was sight impaired. And so the driver would read to her what was in her meal that day. So she would know what was there, what was in her frozen meals, what was in her hot meal. And that was just something that she did. And she was, again, just, that was an aside to her that she was telling me. And I thought, see, these are the touch points that are so important about the service that we offer. So most definitely lives have been saved by us. Following up, we had a situation where there was a gas leak in a home. The volunteer noticed it immediately. The individual did not. We were able to get assistance there time and time again. There have been people who've been unfortunately had a fall at home, but they know that Meals on Wheels is coming that day, or unfortunately sometimes the next day. And we are able to get them help because we follow up on everything best we can. The community is just really important to all of the people that work here at this agency, whether it be in some of the programs you're going to hear about later on today or our Meals on Wheels program.
So we have a question in the chat. Barb White has asked, what kind of locations does the new mobile van stop at to distribute milk, etc.?
So we have a location in Worcester, we have a location in Holmes County, we have a location in Carroll County. We will be opening up some locations in Stark County. We don't currently have any in Summit County, but there's always the possibility that we'll have that opportunity to be able to do that.
And just so you know, if you want to unmute and ask a question rather than type, you're free to do that too.
All right, well, I'm going to go on and talk about then our home wellness program that Lisa mentioned. So that's a team that I work on as well. And we provide a holistic approach to senior care. What our main components are is we provide personal care, we provide homemaker services, we provide chore services. I always refer to chore services as deep cleaning, like spring cleaning kinds of services. And then we have a couple other newer components to the program that I'll talk about here in a few minutes. We are the only organization that I'm aware of that writes grants for direct care of individuals who don't qualify for a Medicaid waiver. So if you qualify for a Medicaid waiver, meaning you meet the financial and the physical needs to get assistance in the home, then you can get that assistance covered through your Medicaid. But there are many people who are just on the cusp of not receiving Medicaid, or maybe need some help with independent activities of daily living that doesn't qualify them because they don't need help getting in and out of a bathtub or getting dressed or those kinds of things. So yeah, I'm not aware of any other agency in Summit County that does that, and we do not charge the client for that. We've had long-standing clients that we have taken care of for many, many, many years. I think 1995 is a client that we've had a client since 1995. Our average longevity of our employees is 15 years. And in the home care industry, to have personal care aides and homemakers and office staff that have been around and stay with us for that many years, it's honestly, it's their love of what they do and our extraordinary clients that we are given the opportunity to take care of. As I mentioned, homemaker personal care and deep cleaning chore services. Homemaker services can be short-term, as our personal care, if it's maybe somebody coming home from the hospital and they just need sort of, a couple weeks of somebody coming out and giving them a hand. Again, we have grant opportunities. We have people do pay privately for services, and we have those who are on a Medicaid waiver who receive our services. And oftentimes the deep cleaning chore service, we get amazing reviews from our clients about not the work that the team does necessarily, because we do get positive reviews about that, but they talk mostly about the kindness and compassion of the individuals that come into their home. Because oftentimes our home situation may not be of our choosing. It may be because we have some medical or mental health issues that make it difficult for us to do some of the deeper cleaning services, or even to push a vacuum cleaner. So they always make the person feel comfortable. And we had one individual who during COVID said, I can't clean anymore like I want to, and I'm embarrassed, and I don't want to have my family come to see me. And we were able to go out and provide a chore service. And so a one-time deep cleaning service meant much more than a one-time deep cleaning chore service, because now she felt like proud again of her environment and could have her family over. And so it was a real blessing for us. So we also have a program that we started, it's been 2 years now, called Caregiver Solutions. So we provide monthly virtual education programs to anybody who wants to register to watch it on Zoom. We put it on Facebook Live. I believe there's some posted on our website that you can also go back and watch. And we have caregivers that come and just listen to resources that are in the community. We've had resources from the Public Utilities Commission, from the Mental Health Board, from hospice agencies, home care agencies, nursing facilities, assisted living, you name it. We've done the person who's in charge, her name's Dana, of gathering all of those speakers, has done a wonderful job in trying to get a breadth of information shared with those individuals. So we've had a lot of positive experiences with that program. We have a caregiver resource fair also coming up in April at the Cuyahoga Falls Natatorium, sponsored by Western Reserve Hospital. So that is something coming up that's very popular. Okay, and our newest program is called Friendly Visitors. Exactly what it sounds like. We were given some funding through Direction Home Area Agency on Aging and Disabilities to provide friendly visits to those who are socially isolated and lonely. We are offering those services in Summit County right now. We'll expand them to Stark and Wayne counties shortly. But we are enlisting volunteers. We have home care staff that go out. It's a 1-hour visit once a week. And it's really just a visit. The one I heard about recently, she got photo albums out and wanted to talk about her family and her kids and places that they vacationed. And I will tell you that that person that went out there got so much out of the visit themselves about learning about this person and different parts of their life. So it was really a win-win for everyone. So this program will go through the end of September, and then it will no longer be funded. So I don't know that we'll have the program after that, but it's currently active. Okay, and that's it for me. I'm up for questions if anybody has anything that I can answer.
I had a question about your wellness program, just sort of about the number of people that are served, and is there a waiting list like there usually seems to be?
There's not a waiting list for chore services. There is a waiting list for personal care and homemaker services. Absolutely, just like you alluded to, that's pretty common practice. Although the waiting list is not all that long, actually.
How would the individual that needed to sign up for the program, how would they go about doing that? Do you guys have an area online where they can go and apply for the grant, or is there information that they can grab to see if they would qualify for the grant?
So there's a referral page on our website. They would just fill out the information about what service they were interested in, and then our intake client specialist team would give them a call and kind of talk to them about our services and discuss with them what programs they may qualify for and what opportunities we might have available.
Another question along the same line. So even some of the programs that don't have that Medicaid requirement, right, that level of people who are more on the cusp, are there financial sort of parameters that you still have to meet for this, or is it truly anybody?
Yes, low to moderate income.
Okay.
Age 60. Then,
Gotcha. Great.
Okay, well, thank you all for your time. I appreciate you letting me share things that I'm passionate about. Thank you.
Thank you so much.
If you all think of any other questions, just throw them in the chat or write them down, and we'll have more opportunity at the end to ask questions about this program as well. We're going to move on to our CSEP program with Robin, and I'm going to let her introduce herself.
Okay, thank you, Lisa. My name is Robin Brown, as mentioned, and I am the Regional Workforce Development Director for the CSEP program, which is our Senior Community Service Employment Program. I have been with Vantage for about 2.5 years, and just as Jennifer finds passion with the program that she's involved with, I find passion in what I do with the workforce development program that's offered through Vantage. I'm honored to present our Senior Community Service Employment Program today, also known again as CSEP, through Vantage Aging for Ohio and Indiana residents who are over the age of 55. The CSEP program is a paid work training program that encourages and lengthens self-sufficiency by supplementing income while providing work training, increased marketability, and opportunities for adults age 55 and older who are wishing to transition into the workforce. Working older adults play an important role in lengthening self-sufficiency, contributing to both personal well-being and societal benefits. Continued employment provides financial stability. You having a difficulty hearing? Okay, let me speak a little louder. I see someone's having difficulty. Let me know if you continue. I'm sorry, I'm kind of soft-spoken, but I'll try to raise my voice a little bit. Working adults play an important part or role in lengthening self-sufficiency, contributing both to personal and well-being societal benefits. Continued employment provides financial stability, allowing older adults to maintain their independence and cover essential living expenses. Remaining in the workforce also helps older adults stay socially engaged, which reduces the risk of isolation and promotes mental well-being. And lastly, active adults, older adults in the workforce contributes to a more diverse, experienced labor pool. Okay, Lisa. The Senior Community Service Employment Program, the process involves making placements, receiving job training, and finding unsubsidized work. If an individual age 55 and older is interested in participating in the program, the first step is to apply by submitting an application to the appropriate regional office. After their eligibility is determined, they're placed at a community organization where they will receive paid job training. We, as Vantage, we actively engage and seek relationships with community partner organizations here. I cover Summit County, Geauga County, and Medina counties. So I'm continually trying to actively involve other community organizations who may be interested in partnering with Vantage to place these job seekers at their particular sites. After they're deemed eligible for the program, they're placed at a nonprofit or government agency where they will receive job training. And the training includes refining their existing skills and also learning new skills for them. They receive a stipend for 20 hours worked weekly, and they can also have an opportunity to earn recognized certificates depending on the career pathways that they choose when they enter the program. The ultimate goal of the program is for the individual to find unsubsidized employment opportunities. So while learning at their training site, they're developing skills with the goal of, again, eventually finding an opportunity that's outside of the program. Okay. Who CSEP serves? To qualify as a participant in the CSEP program, applicants must meet certain requirements. To be eligible for the program, they must be unemployed. They also must be 55 years and older, and we don't have a maximum age. Interesting enough, I had an individual that was about 83 years old, just recently maxed out of our program. She enjoyed the benefit of making the extra money so that she could take cruises every year. So we don't have a maximum age, but we do have a minimum, and that's 55 years old at least. They must have a qualifying level of income, and they must live in one of the Ohio or Indiana counties that we serve. And most importantly, they must be willing to seek and secure unsubsidized employment. We serve 38 counties in Ohio, and most recently we branched out into Indiana, as Lisa mentioned, and we serve 36 counties in Indiana. Okay. Vantage has adapted navigator models that enhances the job seekers' experience while they're in the CSAP program. These models are offered to provide additional support and assistance to CSAP participants on their journey towards finding unsubsidized employment opportunities. We have, with employed through Vantage, we have dedicated professionals who provide personalized one-on-one support with the goal of eliminating barriers related to digital literacy, skills training, and supportive services. Let's explore the navigator models. The first model that we have is called our digital navigators. And our digital navigators provide one-on-one lessons on digital literacy with covering topics such as basic computer skills, Microsoft Office, and internet basics. So they're actually working with individual job seekers one-on-one, training them on how to work via Zoom, and they go into their home and they work and train them on computer basics. And it's one of our most successful programs because we know we live in a digital age, and many of our job seekers feel left behind because they have never had an opportunity to develop those skills. So it's a great program that we're able to offer. Secondly, we have supportive service navigators, and they provide a connection to resources such as housing, utilities, and transportation needs and medical needs. And what this help is helpful, the reason this is helpful is because it assists our job seekers in eliminating barriers that prevent them from getting a job or keeping a job. So it's a great opportunity for us to assist them in providing resources that may be needed. Okay. And thirdly, we have training navigators, and our training navigators provide step-by-step assistance in finding additional training to meet employment goals. When we meet with our job seekers, initially we ask them to let us know which career pathways they're interested in, and depending on the career pathways they choose to take, we look for additional training or support to assist them in finding the skills needed to branch into that particular career pathway. And our training navigators work with them again, one-on-one, helping them to find those additional training opportunities. The goal, the ultimate goal or the main goal of the CSEP program is for the individual to upgrade their job skills and prepare themselves for job placement in unsubsidized opportunities. It's also an opportunity for them to get additional income during their work training opportunities. Again, they're training for 20 hours a week, and we pay the current minimum wage. We help the job seeker get involved with his and her community, which also helps our community partners in delivering the services that they offer to the community. And we help, most importantly, we help the job seeker find unsubsidized employment, which increases and lengthens their self-sufficiency. The program, it's a hidden gem in the community. I'm so happy that Vantage is able to offer this, because we do have a great need here in Summit County, as well as surrounding counties, for individuals looking to re-enter the workforce. And I often hear that one of the greatest obstacles that they encounter is their age. So this allows them to get back into the workforce, gain some additional skills, and eventually leads to our hopes is a unsubsidized employment opportunity. At this time, I'm free to take any questions that you might have.
We have one question in the chat. Are the navigators employees or volunteers?
The navigators are employees of Vantage. So that's their job, and they serve all the counties here in Ohio and Indiana, and they work with all the job seekers who are in need of those services.
You indicated the training was 20 hours a week. How many weeks is that? Does it?
The durational limit for the program is 4 years. So an individual is able to stay in the program for 4 years. But the goal is to help them find employment in 3 to 9 months. But if, say for instance, if they are in the program and they find an employment opportunity and start working and it doesn't work out for them, then they're able to re-enroll back into the program as long as they still have time left of that 48 months or 4 years. Any other questions? Well, thank you so much for this opportunity. I appreciate your time today.
All right. So again, if you think of more questions, don't hesitate to put them in the chat, and we'll also have time at the very end here. And it is my great pleasure to introduce Tessa, and she is going to talk about our AmeriCorps Senior RSVP program.
Thanks, Lisa. Can everybody hear me okay? I just want to make sure we're good. Yeah, okay, cool. My name is Tessa, and I am the manager for the AmeriCorps Seniors Retired and Senior Volunteer Program, which is a total mouthful, but we're federally funded, so you know how that works with all of the acronyms. But I'm going to talk to you today about the Retired and Senior Volunteer Program, how that works, who can be involved, and how we partner with different nonprofits, foundations, places of worship, public safety organizations, and things of the like. It's a really hidden gem. It's a great program, so I'm happy to introduce this to you today. Lisa, if you want to advance. So AmeriCorps Seniors Retired and Senior Volunteer Program connects volunteers who are 55 and older with opportunities to get involved with volunteerism in their communities. It is the largest volunteer network in the country. This is a national volunteer corps, and I'll kind of talk about that in a bit. But essentially what it does is it matches volunteers with organizations where their time, their interest, and experience or skills can make a meaningful impact. So because this is a federally funded program, it's kind of works as an umbrella. So if you've ever heard of the Peace Corps, it kind of is something of that nature. But so essentially we have AmeriCorps at the top, and then AmeriCorps funds AmeriCorps Seniors. And AmeriCorps Seniors has 3 different programs within it, and the Retired and Senior Volunteer Program is one of them. The other one is a foster grandparent program. There's also a senior companionship program, which those are exactly what they sound like. But RSVP is a little bit more in depth, a little bit more detailed. So we do things like foster grandparents and we do things like senior companionship, but we're also able to do a whole lot more based off of the nature of the program. And it's kind of like a twofold operation. So Lisa, if you want to advance. Basically what we do is we find nonprofits or foundations, like I mentioned earlier, who really need volunteers in order to make their missions thrive, and we're able to partner them with our volunteers. So it's almost like a matchmaking service. So Lisa, if you want to advance. When a potential volunteer fills out our application, which I can put that in the chat in just a bit so you guys can kind of see the kinds of questions that we're asking. Once a volunteer applies or potential volunteer applies, then those applications are coming to the managers. And I'll talk about kind of what a manager does in just a minute. But based off of the information that they fill out in their application, we're able to see how much time they want to spend volunteering, where they are and where they want to volunteer, the skills that they have, the things that they're interested in doing, if they're interested in doing something virtually or if they're interested in doing something at home, if they want to be out in the community, maybe they want one opportunity, maybe they want multiple. We're kind of able to take all of this information that they provide via our application, and then we're able to match them with a location based off of the information that they've provided. So if somebody tells me that they are really interested in companionship, but they don't feel comfortable going out in the community because maybe they have a spouse at home who's immunocompromised, then I'm able to partner them with our telecare program, or maybe they want to do a pen pal program, or maybe they're interested in something like companionship and education. They could do something like Project Learn at home, where they could virtually tutor the students who are receiving the education services that Project Learn provides. So there are things that people can do at home, but there are also a plethora of opportunities that volunteers could do out in the community. And based off of the information that they provide, we'll know if they're interested in sticking with one location where, let's say, they go every single Thursday from 8 to 12, and that is their day for volunteerism. Or maybe they're interested in kind of getting their, dipping their toes in the water and experiencing a bunch of different opportunities in the community where they can help out at one-time events, or maybe micro volunteering, where they come and they help out once. Maybe they do specific things like every quarter throughout the year. And we have volunteers who do as many as 6 opportunities. Like their weeks are busier than mine, and they're retired, but they just fill it to the brim, and they're out doing all kinds of things. And then we have volunteers who maybe do one thing for 2 hours every year. So there's no expectation that we put on those volunteers and how much time they have to spend volunteering. It's really what they're able to do and what they're comfortable doing and what fits the bill for them. And then we're able to match them with those opportunities. So the whole point is to be able to provide all of the resources that they can bring to these organizations in the community that are really doing good work, But as we know, if the majority of them are nonprofits, they're notoriously underfunded. So volunteers are really able to help them make sure that the good that they are doing is able to be done by going and providing their assistance. Do you want to advance, Lisa? So these are the 7 counties that we currently cover. I cover Summit, Medina, Wayne, and Geauga counties. I also have a colleague in Columbus. He covers Franklin and Delaware counties. And then another colleague in Cincinnati, her name is Gretchen, and she covers Hamilton County. So the only stipulations that we have for a volunteer to volunteer with us is that they have to be 55 years of age or older, and they have to be located in one of these counties. If they're like right on the outside, but they're volunteering within these counties, that's okay. But we try to keep it to where they're living and volunteering in the same county. And that's really just the only stipulations of the grant. Even though it says retired and senior volunteer program, a volunteer does not have to be retired in order to volunteer. We're just trying to make sure that once people do retire, that they are staying active, both, like mentally and physically, and that we're providing all of these opportunities for them to stay involved, so that provides, betterment for their health, essentially. So the way that we also find opportunities for volunteers is when we initially applied for the grant, and I know that we've had this grant for Summit and Medina County for 40 plus years now. So even when Vantage was mature services, I mean, there are volunteers who have been with RSVP longer than I have been, and they were teaching me what to do when I first started, in 2020. So there are different performance measures that we're looking for when we are partnering with a community like organization. And those things that we're currently focused on are senior companionship, nutrition and food support, employment, and capacity building and leverage. So we're able to partner with our Meals on Wheels program. We have volunteers who go out and help deliver those meals. We're able to partner with the community, the CSEP program, because we have volunteers who are helping, like Robin, if she has, students essentially, and maybe she is a volunteer who's helping with putting together a, what's it called? Somebody's coming in and maybe helping to put together the program for those people who are in the CSEP program. With capacity building and leverage, those would be volunteers who are not necessarily doing front-facing work, but maybe they're on the back end. So they might be doing things, or they're helping with clerical work. They could also be just helping to make sure that that mission is getting put out into the community, but they may not be the ones who are actually serving the meals. They may be collecting surveys and helping with collecting data or things on the back end. And then obviously with senior companionship, we kind of talked about that a little bit, but there are multiple opportunities to get involved in all of these. Currently, we have around 50 community partners. And within all of those locations, we have around 100 and I think 40 right now opportunities for volunteers to get involved. Some of those will overlap per county. So we might have something like the American Red Cross, and obviously that would be in all of the counties that we serve. But it makes it great for volunteers because they're able to do similar opportunities across all of the counties. And then we even have volunteers who are like snowbirds, and they're gone right now, but they could find a retired and senior volunteer program. If they go to Florida, there will be a location that will have that. So it's really cool because the things that they're doing here versus the things that they're doing there may be different, but they're able to be involved no matter where they're located. Lisa, if you want to advance. So why should a volunteer choose to volunteer through RSVP instead of going straight to that organization? Well, number one, a volunteer may not want to spend all of the time looking through newspapers or online. Maybe they don't even know where to start, right? To look for something to do. I find a lot of people that come to us, they don't hear back from some of the places that they reach out to, or they just truly have no idea where to start in terms of volunteering. So if they find us, they don't have to do that legwork. We're doing it for them because we are matching them with all of the partners that we have. So it's kind of like a one-stop shop for them. And if they don't know what they want to do, they can come to us and we can help them find that. We also have an annual recognition event. They're so much fun. Last year we had a speaker. The year before that, we actually hosted it at the Soapbox Derby. The year before that, we had a drive-through, with social distancing. This year we're planning it, and I don't want to put any spoilers out yet, but I think it's going to be really fun. So if we're partnered with a location that doesn't have the funding to do a recognition event for their volunteers, they don't have to worry about that because we are putting that on for the volunteer. And what we like to do is also include our community partners at that recognition event so that they can table and our volunteers can get more exposure to all the different things that they could be doing. If maybe they want to pick something else up to do, they can meet these different locations face to face and kind of get, a feel for other opportunities that may be out there. 3, obviously, we already talked about how this is a nationally recognized network. So they can have the camaraderie of meeting other people and doing that all across the country if they wanted to. We also offer free supplemental accident, personal liability, and excess automobile liability insurance to all of our volunteers while they're assisting at their assigned station. So a lot of people really do like that. And then we try to have little fun tidbits throughout the year with incentives for hourly submissions, or if they're referring other volunteers to our program. We've done like coffee dates before. I try to go out and meet all of our volunteers at their locations. So providing little things for them when I go out and visit them. It just really brings a lot of people together, which would be different from them just going to that location on their own, which is completely fine if they want to. But this is just kind of like an added bonus if they wanted to meet a lot of people, if they wanted to, get updates about things going on in their community and other opportunities to get involved, other than that one place that they may already be volunteering. If you want to advance, Lisa. Any questions about this program? I feel like I kind of flew through that, but if there are any additional questions about how this works, I am happy to answer.
I'm going to go ahead and put the slide up that has everybody's information on it too. And I can make sure that this gets sent out to all as well. You can see email addresses to contact, as well as a lot of this information can be found on our website, and it's pretty comprehensive. We try to make it as older adult friendly also. So if you're referring someone there, that can be helpful as well. And yeah, we're really excited for this opportunity for you to learn more about what we do and then to connect to us afterwards. So feel free to take a picture if you want, or do one of those high-techy things. Go to our website. And then I'm going to stop sharing so I can see what else is going on.